cancer in women
Right.
in the world.
And so when it comes to breast cancer, we was talking about this in particular. Prevention should be the key thing of this, and obviously preventative screening is very important, right? How do you see that happening for yourself in the US? Because can we now take prevention or this screening to the streets? How do we do that?
I think so I talked to you a little bit, I hinted at some economics, but
Sure.
The United States has worked very, very hard, and as you know, we have probably the most expensive health care system in the world. Not necessarily the best quality,
Yes.
good quality, but we spend a lot of money. One of the things we do is we build an infrastructure to support these kind of things. So
Right.
routine colonoscopy,
Right.
routine pap smears, routine mammography. In order to do routine mammograms, you have to have enough centers that have the machines,
Sure.
the x-ray machines, and those could be like stand-up clinics, but they
Right.
could mostly associated with a hospital or hospital system. And you have to have the machines. Then you have to have radiologists that are trained
Right.
and specialize in reading mammograms.
Yeah.
And then you have to have the doctors, the primary care and gynecologists sending women routinely
Sure.
to get the
Right.
screening. And then you have to have a public health system that supports it, including the private sector doing advertisements,
Sure, of course.
non-government entities doing these advertisements
Yeah.
and public health announcements. And we build a culture where women feel compelled to get a mammogram every year.